So good evening once again. My name is GK Emmanuel, the CEO of GK Consult. So today we are going to talk about mental health nursing, and this is the lecture one because this is the beginning of mental health nursing. So in our lesson today, we're going to look at the definition of mental health nursing. We look at the characteristics of a mentally health person, and we are going to look at factors that promote mental health, the observation of mental illness. We are going to look at the determinants of normality and then abnormality so that you know the difference between a normal patient and then an abnormal patient. We are also going to talk about a mental illness. So we look at the difference between mental health and then mental illness. We look at the causes of mental illness. What are some of the causes of mental illness? And we look at what we call the trilogic model. The trilogic model. So according to WHO, when we say mental health, it is a state of well-being in which the individual realizes his or her own abilities. Okay, the mental health. This is when the individual realizes his or her own abilities, and he can cope with the normal stress of life and can work productively and fruitfully, and is also able to make a contribution to his or her community, and not merely the absence of mental disorders. So this definition is making us understand that mental health is not only the presence of mental disorders, okay, but rather, the absence of mental disorders, but rather, if only the individual is able to realize his or her own abilities and capabilities, if you're able to identify what you can do, and you are able to cope with normal stress of life. So for instance, you are not, let's say you've lost your job, okay, you've lost your job. So if you are, so this as one life stressor, someone losing his or her job in the community. So if you lose your job, if you have the ability to withstand that stress by not going wayward to go and steal or to go and commit murder to take someone's money or something. If you don't commit any crime or you don't commit suicide and you are able to withstand the stress of life or cope with the normal stress of life, then we say your mental health is okay. Is that okay? Then we say you don't have any mental illness. Your mental health is okay, or you are mentally well. Is that okay? Then also, if you are able to contribute to the community. So for instance, you are a father, okay, you are a father who take care of children, or let's say you are a mother who take care of children. Now, if you are able to perform your role in the community as a mother and you're able to take good care of your children, we say you are mentally well. But in the absence of you losing your role in the community, then you say you are mentally ill. So it is not only the mad people that you see on the streets who are mentally ill. Is that okay? So that is it. So a state of psychological well-being. So psychologically, if you are well, in which one has achieved satisfactory integration of one's instinctual drives, acceptable to both oneself and one's societal environment. So when we are talking about, or when we are learning mental health, we include emotion of the individual, the psychological and social well-being of the individual too. So it is not only the emotion, but psychologically how the patient thinks and acts. It also affects how we think, how we feel, and then how we act. So you realize that if someone is mentally ill, it affects how the person thinks. The person will think abnormally. How the person feels, even if something has happened that the person has to feel happy, the person will rather be moody. If something has happened that everyone is crying, everyone is moody, the person will rather be hyperactive or super excited. It also affects how we act. Is that okay? And then how we also cope with life. It also helps us to determine how we handle stress. So mental health will enable you how to handle stress and also how to relate with others. So here is when you realize that all individuals are different. So if you know how to relate with others, you will know how to cope with people, and you wouldn't have problem with people. Always, I used to tell people that if you are with someone and then you think the person is worrying, the person is stressing you, it's either you will adapt or you leave. It's either you adapt or you leave. So when we say mental health, if someone is having a good mental health, it is ability for that person to resolve problems. So if you are able to resolve problems, you are mentally well. But if you are not able to resolve problems, you are mentally ill. That is what we are trying to say in this particular slide. It is the ability to cope with crisis without assistance beyond the support of family or friends. So a mentally well-being person is someone who, when he or she falls into a problem or has crisis, he or she resolves the problem and then also cope with the crisis with the assistance of family and friends, but rather not beyond this support. So, for instance, you are financially constrained. You don't have money. You are finding financial challenges and all that. If you are mentally stable, you will rather cope with, or you rather fall on family and friend support, or probably finding a job to do or something. You wouldn't rather go beyond these coping strategies by going to kill someone for ritual in order to get money and all that. So if you go beyond that, for example, going to kill someone for ritual for money, then we say you are mentally what? Ill. That is what we are trying to say. Maintain, so his ability to maintain a state of well-being by enjoying life, setting goals, and what? Realistic limits. So if you are someone who don't enjoy life, you are always timid, you are always sad, you are always depressed. So these are some of the symptoms or signs of mentally challenged person. Always depressed, moody, instead of you to enjoy life, you rather be sad. Setting goals, you have to have aim and what? Achievement. If you don't have aims, you will be living your life haphazardly. And becoming independent, interdependent as the need arises without permanently losing one's independence. So a mentally stable person will always work independently or will always live independently. And even if you fall and then it gets a certain time in life, you start depending on people to survive and all that, you wouldn't maintain into that position for long, or that position would what? Temporary. It shouldn't be permanently. So if you permanently lose your independence, then it means you are mentally unstable. Let's look at the characteristics of a mentally healthy person. So someone who is mentally healthy. After that, we look at mental illness. So this one is mentally healthy person. So mentally healthy person, for them, they possess the ability to accept themselves. Okay, they accept themselves. Unlike someone who is mentally challenged, who will think that, okay, my buttocks is too small, so let me go and do BBL. Mentally or challenged people, but you see them normal walking around and all that, but they are mentally, according to the definition of mental health by World Health Organization, they are mentally what? Ill. So a mentally healthy person will rather what? Have the or possess the ability to accept his or herself and also accept others. So they wouldn't be wanting to isolate themselves. So a mentally challenged person who is having a schizophrenia would always want to what? Isolate his or herself, wouldn't go into public. Anyone that mingles with him or her, he will just, shut the person up and then want to be on his or her own. Doesn't even appreciate nature. But a mentally healthy person would always what? Accept themselves, accept others, and will what? Appreciate what? Nature. Mentally healthy person, they also have positive self-concept, relate well to people and their what? And their environment. Is that okay? They also form close relationship with others and display kindness, patience, and compassion for others. So if someone just go and assassinate a higher personality, or maybe someone just meet someone and then kill the person without any passion, without any guilt, without any shame, nothing, you should know that that person is a mentally ill person. Because a mentally healthy person will what? Will have compassion for others, will display kindness for others, and will also have good relationship and close relationship with what? With others. So you realize that if someone goes into a depression, which is a mental illness, the person tries to isolate his or herself. The person doesn't go close to people and all that. They also perceive the world as it really is. So mentally healthy person perceives the world as it really is, and people as they are by testing assumptions about the world's empirical thought. What it means is that if you are a mentally healthy person, you don't say that, okay, there is no God. You wouldn't say that, okay, there is there is there is nothing like human being. You won't say that, okay, there is nothing strong belief that there is nothing like world, there is nothing like earth, there is nothing like sun. You wouldn't try to perceive the world as it really is. So for instance, we all know that there is a president in this country. There is no president. There is nothing like that. Strong against the reality of the world. You should start knowing that you are mentally what? Challenged. A mentally healthy person is one who appreciates and enjoys life. I've explained it already. They are independent or autonomous in thoughts and action, and they also rely on personal standard of behavior and in values. So mentally healthy people or mentally healthy person, they always think think alone for themselves and they think well, unlike someone who lacks self-confidence. They are also creative utilization of a variety of approaches as they perform tasks or solve problems. Like we said, a mentally healthy person is able to solve problems and all that. They're also able to adapt and adjust to any environmental and psychological problem. For instance, if you face financial difficulties and you are not able to adapt and adjust, and you go beyond that to go and kill someone for rituals, you are not mentally healthy person. You are mentally ill. They're able to relate loneliness, aggression, and frustration without being overwhelmed. So, as a human being, life wouldn't be smooth for you. Sometimes you face challenges and all that, but if you're able to cope with those challenges, you are mentally okay. But if you're not able to cope with those challenges, then you are mentally ill. That is why at points in life, if you are facing certain challenges that you think it is beyond your control, you go and see the therapist. You go and see the psychotherapist so that they counsel you. They pass you through series of therapies so that you don't become mentally ill. So these are some of the factors that promote mental health. So if someone is able to meet one's psychological needs, it promotes the person's mental. So when we say factor that promotes mental health, we are talking about the various things or the various situations, or let me say the various issues that actually make someone to have a good mental well-being. Is that okay? A good mental well-being. So if things or factors like these are missing in your life, you are going to be mentally ill. That is what we are trying to say. So one, meeting one's psychological needs. One psychological needs to promote your mental health. So for instance, you've always dreamed of while you are in your nursing school, you always dream of becoming a nurse after school. And then all of a sudden, the president, or let's say all of a sudden you fail your exams. Your psychological need hasn't come to pass, right? Because you failed your exam, which is going to impose what? Stress on you, which if you are not able to cope with it, adapt and adjust, you'll be mentally ill. But then if you're able to meet this psychological need of you of dreaming to become a nurse in the future, then it will promote your mental health. Meeting one's security and safety needs. You know the Abraham Maslow's um, pyramid, which talks about the what? The basic needs. And then it comes to the safety and then the what? The security needs. So if you meet your security and then the safety needs, that is you are very safe in your environment, you are not threatened, and all of those. Your mental health is promoted. But then if you are threatened, if you've been raped, if you've been abused, and all of those, it will impose stresses on your mental health, right? Which care, if care is not taken, you're mentally ill. So we'll talk about some of the mental conditions as the mental health lessons goes on. Then meeting one's needs for love and affection. So it's also a factor that promotes mental health. So if you are loved by the people that you wish they should love you, or if you are loved by your family members, by your loved one, and all of those, it will promote your mental health. But then if you are denied and you are hated, for instance, your own husband, your own wife, your own boyfriend, your own girlfriend, that you love each other so much, and it gets to a time and then that love and affection is broken, just see how miserable you become. Meeting the needs for freedom and self-respect, meeting the needs for independence and recognition, desire to influence decision, and all of those. And then also rest, sleep, and recreation. All of these promote. That is why anytime we are talking about physical management, nursing management for mentally ill patients, we don't leave out rest and sleep. We don't leave out recreation. So if you go to Pantine, those of you who have ever worked in Pantine, Ankafo, that's a psychiatric unit. If you go there, we have playing grounds, we have table tennis, we have basketball courts, we have all of those over there for recreation's sake, because all of these helps to promote. That is why once in a while you just go for vacation. Even couples, once in a while they go for vacation, or as an individual, once in a while you go for excursion. You just go to somewhere to come and to go and relax yourself, and all that. It promotes your mental health. Identifying one's deficiencies, limitations, and what achievements. Provision of basic necessity. So you realize that if you don't even have money to buy food, to buy water, to provide shelter for yourself, you see how miserable your life becomes. But then if all these ones are put in place, then you say what your mental health is promoted. If you eat well-balanced diet, someone in the morning, kinky, afternoon kinky, evening kinky. In fact, kinky for the whole month. Such a person is not eating a well-balanced diet. So the person will be thinking, if care is not taken, it will impose stresses on the person's mental health, and then it will lead to mental illness. Observation of mental illness. So let's talk about mental illness. Mental illness. Mental illness is the opposite of what? Mental well-being. That's mental illness. So if you don't get all these factors that will promote your mental health, if you don't get them, or they are all absent in your life, then you just switch to mental illness. So usually it is members of the lay community rather than a psychiatric professional who initially recognize that an individual's behavior deviates from the social norms. So basically we say mental illness. If someone is having a mental illness, it means that the patient or the person has deviated from the usual social norms. For instance, so someone who is very well and sound mentally in your town might be mentally ill in my town because of what? Deviation from the social norms. For instance, someone who is from, let's say, a certain community that chews snake meat. When that person comes to me, my community that we don't chew snake meat, and we see the person chewing the snake meat, you will say, no, this person, there is something wrong with you. This person is mentally ill, because how can you chew snake meat? Meanwhile, to the person, everything is normal because that is what they've been, eating in their town or in their community. So mentally illness or mental illness is talking about deviation, okay? Deviation of behavior from the social norms. So mostly it is those individuals that you stay with in your community. They will be the first people to what? To tell you that there is something wrong with your mind or you are mentally ill, rather than a professional psychiatric nurse or a psychiatric professional. Is that okay? So the difference between a mentally sound person and a mentally ill person is just a thin line. Just a thin line. People who are related to an individual or who are of the same cultural or social group are less likely to label that individual's behavior as mental ill than someone who is culturally distant. What it means is that initially there are videos circulating on TikTok whereby there is this country in Ethiopia, is it South Sudan or something like that? One of these countries. For those people, they don't wear dresses. They just cover their breast and then their private parts, and then they'll just be roaming. When you come to this part of the world or the Western world, you classify them as what? As mentally ill people or as mad people. But then, because we are classifying them as mentally ill or mad people because we are what? Distant, we are socially distant from them. We are not staying there with them and we are not practicing their culture with them. But those that they are there don't see nothing wrong. I mean, they don't see anything wrong with it. Is that okay? So it is very people who are related to the individual in terms of cultural or social group basis are able to what? Are able to tag that individual as mentally ill rather than you that you are far away. Individuals in the lowest socioeconomic class usually display the highest amount of symptoms of mental illness. So when you say lowest socioeconomic class, is those that they are not doing well in terms of finances and all of those. So people that they really have financial challenges and not living well and all that, they are not that economically and socially stable, they usually display the highest amount of symptoms of mental illness. For instance, you are broke, you don't have money, okay, you don't have money, and you've had these financial challenges for almost 5 years. Just look at how miserable your life will become. Sometimes you can even go out without even dressing your hair. You can even go out without even you forgetting that you haven't even worn dress. You see how low socioeconomic class can make your life miserable. But there's someone who is well doing, having money and all that. That person has time to take care of him or herself because there is money. The higher the social class, the greater the recognition of mental illness behavior. For instance, someone who is at the low social class, is not well doing in life and all that. That person wouldn't see his or her miserable life really as a mentally ill person. For instance, you are not well doing in life and all of those. So if you even wear dresses which has things or which is tattered, it is normal because everybody knows that you don't have, right? So you wouldn't see yourself as mentally challenged person, or people around you wouldn't see that you are mentally challenged because they know that you don't have and you are wearing what you have, rather than someone who is of higher social class, like someone who is rich and you know that yes, this person can afford expensive dressing. That particular day, that such person that we think he can afford expensive dressing, that particular day that a person decides to wear normal dress, like low class dress, you start seeing that this one that he has worn just something normal to this event, meaning this person is not okay. So you see that in that context of the person who is in a high social class, we are able to what? Recognize his mental illness behavior fast than someone who is of social economical class. I want you to pay attention to this part, this aspect, that the lower the social economical class, the higher the amount of symptoms of mental illness you display or you manifest. And then the higher the social class, the greater the recognition of mental illness behaviors. Pay attention to that. And then the more highly educated person, the greater the recognition of mental illness behaviors. Pay attention to that one too. Now let's quickly run through the determinants of normality and then abnormality. Or how can we differentiate between normal behavior and then abnormal behavior? The difference between a normal behavior and then an abnormal behavior. All right. What society considers as normal is based on common beliefs. That is one thing that I want you to know. Is that okay? That what society considers as normal is based on common beliefs. Like the example that I gave, that someone who chews snake, or let's say in his community they chew snake meat, but in my community we don't chew snake meat. Now the person who is in the community that they chew snake meat, the people in the community they see it as normal because of their belief that snake meat is not like is something normal. So they see it as well. That's what I'm saying, that what the society will consider normal is based on their what, on their belief. But based on our belief, chewing snake meat is not normal. So if you come and chew snake meat in my community, we will say you are mentally ill. You are what? You are an abnormal person because of our beliefs. But then their belief says that it is normal, so that's normal for them. So what might the behavior that may be normal for your community, it may be abnormal for my community. That is one thing I want you to put in mind. The concept of normality therefore differs from place to place and then culture to what? Culture. In certain places, if you just catch someone and then slap the person on the street, it is normal. Life goes on. But then in a certain community, they will see that person as a mad person, and then everybody will start running away. And then different culture have wide range of what, social norms that are considered as appropriate for different age groups and then gender. So one major factor that differentiates normality from abnormality is the cultural context. The cultural what? Context. The cultural context. Now, culture is a pattern of behavior and then interactions, cognitive structure, and understanding that are shared and learned through the process of socialization, which we all know. Now, from the above definition, you realize that what society considers as normal is based on their cultural belief, like I said earlier. Is that okay? So the cultural context can determine whether this one is normal or this one is abnormal, whether this person is mad or this person is a normal person. The example that I gave about the snake meat explains this one better. If you have any question, just drop it in the comment section, okay? After these lectures, I will pause and then ask questions. So just jot your questions down, jot them down. And then another factor, so we look at one factor, that's the cultural context. Another factor too that differentiates between or that determines normal and then abnormality, or normality and abnormality, is incomprehensibility, lack of understanding. That's what incomprehensibility. So, for instance, someone is we've seen someone naked on the street. We've seen someone naked on the street. Incomprehensibility means we not understanding or lack of understanding. We are not understanding why that person is naked on the street. So we will jump into conclusion, the person is mad. But to the person, he understands what he is doing, so he is not mad. I don't know if you get me. A typical example is someone who has lost a maternal mother who has lost her baby during during labor. If the mother realizes that the baby is dead, the mother will start shouting, will start crying, will start going mad, will start going crazy, running up and down. Someone who is sitting at back will watch this woman and say that, this woman, is everything okay? Is she mad? Is she going crazy? She's mentally ill. But to her or to people who are around, knows that the woman is not mentally ill, the woman is not mad. Just that the people outside are not understanding or are refusing to understand him. So that's the incomprehensibility. So it relates to the inability of the general population to understand the motivation behind that behavior. If someone just get up and start killing his enemies, to him, he's doing the right thing. He's killing his enemies. But people outside the context who don't understand that those people that the man is killing is are his enemies, they will start judging that, hey, this man is a murderer, this man is doing that, but they don't know what are really happening that the man is doing that. So they will conclude that the man is mad because he has started killing people. That's incomprehensibility. Third point, deviation from the average. Deviation from the what? From the average. For instance, We are all nursing students and we all wear our nursing uniform to work. Always, we've all been wearing our nursing uniform to work until one of the working days. Dora Champon decided to wear short skirt and then crop top to work. We realized that our sister Dora Champon has deviated from the average. She has deviated from the standard norm. So all of a sudden we will meet our sister Dora Champon at work and we'll be like, hey, is everything okay? That's the first question that you ask. Is everything okay? That's what we will just jump to the conclusion that this girl is not normal. So that is one. So if someone deviates from the average, it will also determine whether the person is normal or is not normal. So that's an example over there. Then deviation from the idea. For instance, we've all understood or we've all agreed that we would all donate our salaries to the orphanage. We've all agreed on that we will donate our salary to the orphanage. And then all of a sudden we will receive the salary and you see that no, I'll change my mind. But rather you'll be using your money for different thing else. You'll be like, is everything okay? So you say what you are doing is an abnormal thing. For instance, so an alternative approach considers abnormality in relation to the standard towards which most people are striving. So, for example, a sense of, I am trying to look for the example that I placed in here. Okay, that's fine. I guess the example that I gave has explained it. So it's like all the group has their main idea, their main objective, and only you are deviating from the set goal of the group. And then we have a legal concept. Is that okay? A legal concept. We have a legal concept. So sometimes, all right, so I've highlighted this, a legal concept. So sometimes it is certain behaviors has been happening, all right? Sometimes certain behaviors has been happening, but then we see it as normal until it causes a problem. And we take it to the court and then we realize that this one is not a normal behavior. Is that okay? So according to the jury that first heard her case, so this one is a case law, okay? I'll explain to you. So according to the jury that first heard her case, Andre Yates, a woman who drowned her 5 children in a bathtub, was seen. She was sentenced to life in prison for her act. Now, although you might question this view, that's land a later appeal jury overturned the conviction or whatever. The initial verdict reflected the way in which the law defines abnormal behavior. What I'm trying to say here is that, for instance, you are, let's say you have children at home, and you decided to starve the children. After all, they are your children, is that not it? You decided to starve your children. If your colleague hears that, it may sound normal to your children. Maybe probably your children did something wrong and you decided to punish them, right? So it may sound normal to everybody in the community. Oh, the children are doing stubborn things and then the mother decided to starve them for like few hours, be like that, or just a day for them to learn their lesson. But then if this case should be taken to the court can decide that what you are doing is wrong, what you are doing is abnormal, and they will quote a place in the constitution for you that according to at so and so and so and so and so and so. And because of that judgment in the court, they can use that as a standard to differentiate whether what you did is normal or not normal. So that is the definition. Like I said, if you have any question, you can let me know. So in some states, when we say insanity, it simply means that defendants cannot understand the difference between right and wrong. So sometimes you hear them saying what he's doing is insane. What he is doing is insane. He's insane. He's insane. It means that the person is refusing to what, to know the difference between right and wrong. Then we say you are insane. So if you tell someone you're insane, it means the person doesn't know the difference between right and wrong. Is that okay? So when we say mental illness, it's a maladaptive. So it is the opposite of mental health. Is that okay? It's a maladaptive response to stress from the internal or external environment, as evidenced by thoughts, feelings, and behavior that are incongruent with or interferes with the individual's cultural, occupational, and then physical function. What it means is that mental illness simply means that the inability for you to adapt to stress. Is that okay? If you are not able to adapt to the stress from your internal and external environment, you are mentally ill. Simple and short. So if you are facing financial difficulties and you are not able to withstand that problem and solve it by searching for job, by asking for help from families and friends, and you go ahead to you let that kind of internal or external environmental stressor stresses you to the extent of going beyond to kill someone for rituals to get money and all that, you are mentally ill. That is what we are trying to say. And how do you know that someone is mentally ill? It's as evidenced by the person's thoughts. The thoughts that will come into your mind. So, okay, so hey, I need money. I am broke. I am financially stressed. I am facing financial difficulties. Let me go and kill someone to go for money rituals. I know some alarm somewhere. If these thoughts keeps on running in your mind, is an evidence of mental illness. And how you will feel. You will feel very depressed. You will feel very bad. You feel very sad. And if you feel depressed, sad, and all of those, and this persists, one evidence of mental illness. And then your behavior alone, you start behaving awkwardly. You start stealing. You start bullying people, and these behaviors they are incongruent with, or it interferes with the individual's culture. So in your society, they don't steal, but because you are financially stressed, you've let that stressor make you to go and steal. It has made you to act or behave in a way which interferes with the culture in your society. Is that okay? Because of even mental illness, some people wouldn't be able to adapt to stresses um, in their environment, and then they will even go ahead to start drinking. They have a lot of problems, so they think when they drink, the alcohol or they becoming drunk will solve their problem, but that's not the case. So when it happens that they will continue drinking to the extent that it will even interfere with their occupation, they will be skipping work, and then it will get to a time they will just sack them from work. Do you get the whole thing? So if you are not able to adapt to internal and external environmental stress, which is evidenced by your thoughts, how you feel, and the kind of behavior that you put out there, then we say you are mentally ill. So causes of mental illness. Causes of mental illness. So we have the predisposing factors. So some predisposing factors that may predispose someone to mental illness is hereditary. So we have the hereditary. Then we have the genetic abnormal. So the hereditary, sometimes we will look at types of schizophrenia. Sometimes your mother is having schizophrenia, your father too is having schizophrenia, and they never went for marriage counseling, or they never went for premarital counseling. And then they are likely to give birth to a child who is also suffering from schizophrenia. That's hereditary. And we have genetic. So under the hereditary, we have the genetic abnormality. Sometimes, yes, like I said, two depressed patients and two depressed couples, they are likely to give birth to a depressed couple. And it can run through the family, like schizophrenia, like the first example I gave. And under the hereditary, we have chromosomal abnormality, like the trisomy 21. So they are all there. Then we have the body constitution. So this one is also hereditary, 1 point. Under hereditary, we have the genetic factor and then all of this. Now, the second point is constitution. So the body's constitution. So that is relatively permanent physical organization of the body as one interacts with the environment before birth, which can be enhanced in the course of life. So what it means is that you see how physically you are or your physical structure will determine your mental illness or how easily you be prone to mental illness. So there is when before I was entering into the health field, I used to hear a common saying that hey, short people and their heart. Short people they have heart too. Short people something small they will get pissed off. Short people are this, short people are that, and all of those. I used to hear it a lot. Now with this one, you will understand why they say that. Yes, it's true. You will understand why they say that. So we have three basic body composition, and they all contribute to how predisposed you are to getting mental illness. So one, we have the picnic body build. So we have the people who have the picnic body build. These people are very short and they are fat and they have round trunk and then they have short neck. So you see, people that basically people that they are short, these individuals exhibit mood swing and are vulnerable to suffer from manic depressive disorder. And we look at what manic depressive disorder is. So the what I want you to get is that they exhibit mood swings. So short people, they easily get annoyed, they easily get happy. So they exhibit. So if you know short people, you can just relate. Then we have the athletic body build. Those that they go for gym and all those that they are muscular, they have broad shoulders and broad chest, they are relatively small, waist and all of those. Those people are vulnerable to suffer psychopathy and epileptic psychosis. Psychopath, you look at what it is. And then we have the asthenic body build. They are relatively tall and then they are skinny. They have long trunks and they are less muscular or fat. They are also prone to suffer schizophrenia. So these ones are assumptions and they are very true. Those of you who have happened to work in a psychiatric unit or done your clinicals or working in a psychiatric facilities, you would understand what we are saying here. It's really true. And also your age can prone you to getting a mental illness. Is that okay? So like the aged, and then in the adolescent stage, the aged, you are prone to getting mental illness like dementia and all of those. And then your adolescent stage, you are likely to get this kind of schizophrenia, depression, and all of those. And sex, depression is more common in females than in males. And then psychopathy is also common in males and females. So for the depression, you can all testify to the fact. If if two lovers, boy and then a girl, and then they break up, who suffers heartbreak the most? Is the females, because depression, they are very vulnerable to depression. So those are the predisposing factors. When you say predisposing factors, they are the factors that would put you to a risk in getting the mental illness. We have precipitating factors. When we say precipitating factor, they are the immediate events in a person's life that brings on the disorder. Is that okay? For the predisposing factors, if you fall into any of it, you are likely to get it. But the precipitating factors, it means that they are those kind of factors, okay, those kind of factors that are in, I don't know how to say it, but then they are in your immediate life, or they are factors that are happening. Is that okay? That are happening. That's when you are prone to it or when you are exposed to it. So we have any loss at all, maybe loss of loved one, loss of job, loss of anything, physical disease, and all of those. They are precipitating. So it means that the mental illness is there. But this one will trigger it. Is that okay? Then we have the perpetuating factors. So, okay, good. The precipitating factors is more or less like triggering factors. The mental illness is there, okay? But what will trigger it? For instance, someone who is having a schizophrenia, the person is having schizophrenia, has been diagnosed of schizophrenia, and then the person is under therapy. And all of it, so such person would have a precipitating factor. If the person loses his or her mom, all of a sudden it will be triggered. The schizophrenia is there, but because of therapy, it is being managed. So it's kind of he's kind of getting freed out of it. But as soon as the person's mother died, the schizophrenia will just be triggered. So they are immediate events. It will just be triggered. Once the person loses job, it will just be triggered. The person is a drunkard, which is a mental disorder, alcoholism. But then the person has decided to, to put a stop to it. As soon as the person's wife starts misbehaving at home, he'll go back to the drinking spot, go and drink. So those are precipitating factors which will trigger. But then the perpetuating or the maintaining factor, they are factor that will worsen it. That will worsen it, especially someone who is an alcoholic patient. Okay, alcoholism, and such person is not getting the love and the care. All of a sudden, the wife has divorced him because you're a drunkard, so I've divorced you. All of a sudden, the children are not even they are not even taking care of him again. They are not minding him again, and all of those. All of a sudden, the person would even trigger the person to to drink more. It would even make the person to drink more. So extra attention given to an unacceptable behavior or sick person, a depressed person withdrawing from friends. So the patient is depressed. And instead of he to get friends that will come closer to him to come and console him and all that, but rather friends that are abstaining themselves from him. This factor would worsen the person's depression case. This is what we call the trilogic model. So the trilogic model is just explanation to the various factors. So we won't keep long here. I'll just glance through, then we would end lecture 1. So with the trilogic model, we have the trimester. So we have the host factors. We have the what? The host factors. So when we say the host factors, they are those factors that is based on the host. Is that okay? They are those factors that is based on the what? On the host. Then we have, so under the host factors, it could be hereditary, it could be chromosomal abnormality, which I've explained already. We are still on the host factors. It could be personality type, and we looked at the 3 personality types. It could be unresolved emotional conflict. It could be sex, it could be age. Sex means the gender. Then we have the second factor of the trilogic model. We have the agent factor, which could be a certain thing that is posing the patient to getting mental illness. So the first one was the factor that is as a result of the person himself. This one is something that is causing a person. So we have head trauma. So someone can get head trauma and the person will be mentally ill. Infections like meningitis, brain structure abnormalities, childbirth, nutritional deficiencies, alcohol, chronic terminal illness, and all of those. They are all agent factors. Then we have the environmental factors. What is it in the environment that would predispose someone in getting mental illness? Lack or disorganization of one's primary support group. For instance, you had your wife, but now there is divorce, so your wife is gone. You had family members, all of them are dead. Stress in the social environment, educational stress, and then all of those. So at this point, if you have any question, you can ask. So this is the end of lecture 1.